CNA vital signs demo,
Right.
pulse and respiration step by step.
Alright, hello everyone. We are about to go through our skill, pulse, and respiration. And prior to us going over that skill, I want to identify some important things that you will need to know for the state exam in regard to your CNA skill, pulse, and respirations. So, we're going to talk about the most common site that is assessed. The most common pulse site is the radial pulse. The radial pulse is located at the thumb side of the wrist. You will use two fingers to assess your radial pulse. You don't want to use your thumb, or you may feel a pulsing sensation coming from your thumb. So it is good practice to use two fingers to assess the pulse here on the side of the wrist where the thumb lives. This is your radial pulse. After you have assessed the brachial pulse, you will take your blood pressure cuff and align the arrow near the pulse site that you assessed. So we use our radial pulse to assess our pulse, and our brachial pulse is assessed prior to taking a manual blood pressure. So when you are assessing your apical pulse, you will need to utilize a stethoscope, and you will need to listen to the heart rate for at least 60 seconds while counting the beats. So for the CNA state exam, you will need to know that the radial pulse is the most common site where the pulse is accessed. It's located on the side of the wrist where the thumb lives. You'll utilize those two fingers and not the thumb. In order to capture a manual blood pressure, you will first need to assess the brachial artery that is located in the middle of the elbow. After you have assessed the brachial artery, then you can line the arrow on the blood pressure cuff where you felt the brachial artery. When you look at the inside of the blood pressure cuff, there are arrows on the inside of a manual blood pressure cuff to tell you exactly where you should place the arrow in order for you to accurately hear the sounds of the brachial artery when capturing the measurements for blood pressure. So you will need to assess the brachial artery first by placing two fingers in the center of the elbow. After you have assessed the brachial artery, you can feel it. You will apply your blood pressure cuff with the arrow pointing to the area where you assess the brachial pulse. You want to take that arrow and make sure that it is pointing to the exact spot that you felt when you assess the brachial pulse. It's important that you know that in order to assess an apical pulse, you will need to use the instrument called the stethoscope. And you will listen in the left center of your chest, which is the lowest pointed end of your heart. You will need to listen for at least 60 seconds while counting the heartbeats. These are the three things that you need to know for the CNA exam regarding the pulse. Now we're going to name the different pulse sites. You have your radial pulse, which is located at the wrist. You have your brachial pulse, which is located at the middle of the elbow. You have your femoral pulse, which can be palpated on the inside of the groin area. You have your carotid pulse, which can be palpated on the side of the neck. You'll take your two fingers and place them in the center of your neck and slide them over to the first groove and press down in order to feel your carotid pulse. You have your popliteal pulse, which is located behind the knee. You have the apical pulse, which requires that you utilize a stethoscope in order for you to hear the heart. You also have your posterior tibial pulse, which is located on the side of the ankle. And then you have your pedal pulse, which is located at the top of the foot. So that, knowing the different pulse site, is just extra information that comes along with being a Allegiant CNA. So now it's okay for us to go over the skill, vital signs, pulse, and respirations. Also, in order to accurately count the respirations, you need to watch the resident's chest rise and fall, like so. One rise and fall is the equivalent of one breath. And you will assess the rise and fall of your resident's chest for at least 60 seconds in order to get an accurate account of their respirations. Remember, in order to pass this skill, your respirations will need to be within 2 breaths of the RN test observer. And your pulse measurements will need to be within 4 beats of the RN test observer. I know that you're going to do well.